So you need a service, a product wedge. You also need a financial wedge. You have to think about both, and you need to work in a synchronized, orderly fashion. And solving for the financial part, who's paying for it, is extremely challenging. That's what makes healthcare so hard.
You mean because insurance? Because you have to be thinking about insurance companies or people with a lot of extra money? That's
Healthcare is
it?
very expensive,
Yeah.
and if you don't have health insurance, you have to fit in everybody's pocket. So it's not like you're paying $2 a day, $2 a month, $10 a month, and you're having full access to what you need. And healthcare is getting way more expensive every year. And the populations around the world are aging. And when we age, we tend to go to a doctor like 4 times more than when we were younger. So 80, 70 years old person goes to a doctor on average 8 times a year. And when we have 20, 25 years old, if we go once, like we're top quartile. So let's say, and the average population in Brazil is about 30 something years old, I would say, or I wouldn't. So, and that's about twice a year. So there's a 4x gap. So people are aging. Brazil is aging fast. So our demands are increasing, and costs are also increasing. Costs of services and medication
Why?
and equipment, because there's a medical inflation in the sector. New equipments, new technologies are more expensive. New medication is expensive. All of that piles up and increases costs. So there are many forces playing, and you have to kind of be multimodal when you look at healthcare. And then you have, just to make things hotter, big payers are companies, but you have health insurance companies paying hospitals and providers, and hospitals are trying to put pressure points over health insurance companies and vice versa. And there's a war happening, and you're trying to fit in, and how you're going to fit in, and who's going to be your ally, and who are you going to add value to. At the end of the day, we need to add value to the patient. The only way to do it is to have an amazing partnership with doctors. So things can get very complicated really fast. It's like a 2,000 pieces puzzle that you need to put up and organize.